It is with great pleasure that I stand here today to officially launch the National AIDS Coordinating Committee, the NACC. I see so many persons and organizations present here today who have been and continue to be at the forefront of this continuing challenge to combat HIV and AIDS. As many of you know, Trinidad and Tobago, the first case of HIV was diagnosed in 1983. Since that time to now, we have faced many challenges with respect to the control of HIV and AIDS in Trinidad and Tobago. However, we have also made great strides and achieved major successes. I want to therefore take the opportunity to encourage us all to remain steadfast as we work collectively and collaboratively towards the goal of ending HIV transmission by 2030. We are mindful of issues surrounding stigma and discrimination, which impede persons from coming forward to access testing and services in the public health sector. Therefore, we want to continue our efforts to reduce those stigmas by creating spaces where persons can feel fully comfortable to access testing and services. The NACC will be guided and framed by government's National Development Plan, which is focused on empowering the people of Trinidad and Tobago to lead healthy lifestyles by ensuring that citizens have information to make decisions and facilitate behavioral change, and through continued engagement of key stakeholders and mainstreaming of health policies across all sectors. This focus recognizes that HIV transcends a clinical medical response. At the core, it is concerned with human behavior, which is multidimensional and multifaceted. Our response must therefore be multidimensional and multifaceted in nature and have at its core behavioral modification. We in Trinidad and Tobago, along with the rest of the world, have committed to ending the AIDS epidemic by 2030. I am therefore pleased that so many key organizations present here today have already developed various ways to address this epidemic. The public health sector, the NGO sector, the faith-based organizations, the private sector, and academia are all working relentlessly to protect the people of Trinidad and Tobago by identifying the gaps and taking steps to fill these gaps and remedy the situation with the expected result of ending HIV/AIDS by 2030. We are also very grateful and appreciative for the continued collaboration with our international and regional partners, who, I must say, work in synergy with governmental and non-governmental organizations to support the national effort. In the existing challenging economic climate, there is an even greater need for a sustained collaborative response to HIV/AIDS. I therefore commend the work completed and that ongoing of our partners here today. Your investment of time, money, and other resources must not go unnoticed. And it must not go unnoticed because I'm sure almost every one of us in this room would have known or know someone who has been affected by HIV and AIDS. In my own family, I have family members who have been affected by HIV and AIDS and friends who have been affected by HIV and AIDS. And it's the hard work of those who are on the ground, the faith-based organization, the NGOs, who keep them up and keep us going. So I want to pause and say thank you. The terms of reference of the NACC provides a clear mandate for the committee of specific priorities, the development of the national policy for HIV and AIDS, which would incorporate policy guidelines for HIV testing, treatment, key populations, psychosocial issues, behavioral change, and gender issues, just to name a few. Additionally, priority must be given to the evolution of the NACC into a statutory body of appropriate entity, the acceleration of the legislative agenda, and the finalizing and implementing the National HIV and AIDS Monitoring and Evaluation Plan. The work of the NACC would be undertaken at the subcommittee level in the areas of prevention and control, treatment, care, and support, creating and enabling environment for improving the quality of life of those infected with and affected by HIV and AIDS. And I just want to pause to really say thank you for those who have been working to make this happen today. And I want to especially thank Dr. Andrews. I know she has been at it really hard, coming to meetings with me and pulling all the stakeholders together. So Dr. Andrews, I want to publicly say thank you for your hard work. Trinidad and Tobago's approach to the implementation of the 2030 Global Development Agenda will begin with the unfinished business of the Millennium Development Goals, the MDGs, in areas such as maternal mortality, containment of HIV/AIDS, and reducing the incidence of non-communicable diseases, and transitioning to the Sustainable Development Goals and the 2030 Agenda. While this may seem as a tall order considering the human resources of the NACC, I want to give the assurance that all efforts are being made to ensure that the Secretariat is staffed with competent, qualified, experienced, and, I say, committed, loving, patient individuals who can take the response forward. And I also want to identify that we have a permanent secretary who will be specifically charged with overseeing this unit. And although he's not here, I know his heart is with us. So I want to publicly thank P.S. Yearwood for his support, as well as P.S. Jones and P.S. Johnson for their support in the absence of P.S. Yearwood. On this score, one of the decisions of the government is that there would be a review of the operations of the NACC after 6 months, and that recommendations will be made by the NACC with respect to further staffing, operations, transitioning to a statutory body or appropriate organization, finalization of the national policy, including policies with respect to testing and treating. Ladies and gentlemen, the committee has a great responsibility for spearheading the groundwork for combating HIV/AIDS and championing the continued public education initiatives. It is therefore critical that we continue a thrust in finding creative ways to engage the public to ensure that they not only have the right information, but practice the right thing and right behavior. I encourage you all to keep the faith. Be steadfast even in the face of severe challenges and obstacles. Always remember the reason why we are doing this. We are doing this to improve the quality of life for someone who is living with the disease. We are doing this to improve the quality of life for our brothers or sisters or neighbors or family who have been affected by this disease. We are doing this to improve the quality of life of all of us who live in this beautiful island, Twin Island Republic called Trinidad and Tobago. We are doing this to protect those not yet infected so that they can remain HIV negative. In closing, let us challenge ourselves to step up a notch or two as we recommit to making HIV and AIDS a thing of the past.
How much closer do you think we are to closing the prevention gap when it comes to the reduction of new HIV cases, primarily in the Caribbean?
Well, I think that we were in a good position, and if I were answering that question before July, I would say we are in an excellent position. But there has been a report from UNAIDS, the GAP report on prevention, issued in July, and it showed an alarming fact that the Caribbean had an increase of 9% of new infections between 2012 and 2015, when in fact before that we were the region in the world with a decrease which was complementary and really would have caused us to be way ahead in terms of prevention. Now, why this sudden increase? We have been examining some preliminary reasons, and we think that they have to do largely with general complacency. The fact that we were celebrating success, and now we found that there were issues related to lack of adherence to the drugs. We found stockouts on the part of several governments in the Caribbean. And in addition to that, what we discovered was the increased the increased identification of stigma and discrimination, especially among key populations. And so these things combined together created the spike. I must say that this might be happening, however, in some countries more than others. But nevertheless, in the Caribbean as a whole, this is something that we have to address immediately. I would say, too, that when we look at what we need to do, it seems to me that a very important aspect, not only paying attention to investing in key populations and ensuring that they have access, but also paying attention to the issue of young women, especially where we are seeing, again, a spike which did not exist prior to 2012. And there must be some reasons for that. And what is happening and what we are now determining, looking at some of the studies, they have to do with, I would say, related issues of the increased violence and abuse of women and girls and in adolescents. It has to do also with a general issue of sexual education. We are shirking away from age-appropriate sexual education in our schools and our communities and even in our religious organizations. And so we believe that there are corrective things that can be done to immediately address the situation. And so to answer your question, I feel hopeful that from the perspective of interactions that I have with various stakeholding groups like civil society and faith-based organizations and parliamentarians, that if we make a consolidated effort, we can reverse that trend in 2017 and beyond.
Fast track to 2030. I want to be the devil's advocate here because we've had conversations, maybe not you and I, but in terms of the complacency level in the Caribbean and the result of the complacency level. You mentioned women and girls. Is there enough being done to protect women and girls against HIV infection, especially when you look at sexual exploitation? Is it that we've just reached a stage or a place here in the Caribbean where we believe that because HIV is no longer a death sentence, that we've just let everything fall by the wayside? You mentioned a consolidated effort, but are we in a position where governments now in the region are willing to come together to ensure that we bring those numbers down in terms of the increase that we have seen, the spike that we've seen? And we're going to ensure that women and girls are protected. Stigma and discrimination, how are we going to deal with that? I mean, from where you sit as ambassador, there's a lot on your plate. What can you say to us looking at zero in 2030?
Well, let me take two issues. The one with women, girls, and children, and then the other dealing with stigma and discrimination, especially among the key populations. In the first instance, why I was a little optimistic when I spoke was the fact that I think governments are taking the issue of violence against women, girls, and children very seriously. Recently, in earlier this year, the governments of the region came together and accelerated a program called Every Caribbean Woman, Every Caribbean Child. And that program is championed by the First Ladies of the region, of which your First Lady is one, but also endorsed by the CARICOM heads of governments at their meeting in July of last year. And as a result of the program, which has a steering committee chaired by the UNFPA and CARICOM Secretariat, there are four things that have been promoted as priorities. One is the reduction in violence against women, children and girls. Children and girls. Secondly is the reduction in cervical cancer, which is quite high. The third is the reduction in teenage pregnancy in the Caribbean, again high with all the health consequences. And the fourth issue has to do with eliminating mother-to-child transmission. And in the Caribbean, we are in a good position. We could be the first region in the world to eliminate mother-to-child transmission because 12 countries in the Caribbean are on the verge of being certified. And you know, Cuba in this region was the first country in the world to be certified. Now, that's one program, and that was taken to the Clinton Global Initiative in September, and it will now be going forward to the corporate partners in the Clinton Initiative for funding in March. Now, that is very important, and it signified to me that the key partners are championing the issue. The heads of governments have endorsed it, and I think it could be a very worthwhile movement in all the countries. What has to happen, however, is that there must be sanctions. We can't have policies against violence and not sanctions.
That's correct.
And therefore, I think that we have to increase the propensity of our legislative capacity to deal with this issue. But legislation alone will not do it. There is a very interesting complementary phenomena which occurred in Jamaica, which I think is so important. It is a program that one UNAIDS introduced in Jamaica called He for She, in which the Prime Minister of Jamaica, Andrew Holness, and the indomitable Usain Bolt are champions of He for She, which means that men are part of the solution of every Caribbean woman, every Caribbean child. Now, to me, that is a great step. And if we can do that in other countries in which we involve men and boys in that process, then you see we move it just from legislative sanctions to a more comprehensive social and gender-based program. With respect to the issue of stigma and discrimination, this is a big problem. There is in the Caribbean what is deemed to be a high percentage of homophobia. I personally think that the percentage is lessening. More and more people are recognizing
things are changing,
that there is need to bring the marginalized into the fold and to have programs with less stigma and discrimination, so that our public health, for example, should not discriminate against people because of their sexual orientation. And so I think more and more countries are evolving, and with that we are finding that there is increasing access of men who have sex with men and sex workers. In fact, sex workers, the incident has dropped tremendously over the past 5 years, whereas men who have sex with men, the incidence has maintained quite high. In Jamaica, for example, 32% in Jamaica, and about 25% here in Trinidad and Tobago. So we still have to work on that. But how are we working on that?
How do we reach the masses?
We are working on that because we're engaging stakeholders, faith-based organizations, parliamentarians. The CARICOM youth ambassadors are playing a very vital role.
Most important.
And we are also involving the private sector that must introduce workplace policies to handle stigma and discrimination. And what you will be pleased to know is that in 2017, there will be a series of consultations dealing in what can various stakeholders do to end AIDS by 2030. So the faith-based organizations will be having a regional consultation of about 60 faith leaders here in Trinidad and Tobago on the 1st and 2nd of February on that theme, what can faith leaders contribute to ending AIDS? And included in the outcomes of that particular forum is to what extent can faith leaders adopt programs that reduce stigma and discrimination. Now, to me, that is a great advance. And as you would know, Belize just had a ruling by the Chief Justice about 2 months ago that, that discrimination of individual on the basis of sexual orientation is unconstitutional. And so the Belize delegation at that conference will be speaking on what that decision means to the views and actions of stake leaders. Now that is an advance. And to me, that you would have respectful dialogue is an important factor. And in the context of that development, there is a planned consultation between faith leaders, representatives of faith leaders, and representatives of key populations to happen later in 2017, where they will each discuss, and they will together discuss, how can they collaborate in moving a process forward to eliminate AIDS. Now, to me, that is progress. And to me, too, it is progress which is beyond the capacity of litigation, because you can litigate and you could win, but you can't change hearts and minds by litigation. So that, to me, that process. I mentioned the youth, the CARICOM youth ambassadors. They have agreed to focus attention on prevention. And as we said, this is very important because the youth tend to feel that they're invincible. But the CARICOM youth ambassadors have decided to embark on a real strategic, incisive level of public education using social media. And you know that is a very important mechanism for communication. Yes. And therefore, I think that they are doing it with the sponsorship of certain companies, Digicel, and their respective companies, local companies that are in charge of mobile technology. Now, I feel that events and activities like that could make a difference because it would reach the youth in the areas that appeal to them most and by the technology in which they deal.
I'm wondering, though, if because of the downturn or the economic atmosphere in the Caribbean, it would have hampered funding from corporate Caribbean, not just Trinidad and Tobago or Ghana or Barbados or Jamaica, but in terms of, again, funding events where the youth ambassadors could actually get involved and at least get the message out there, because it really boils down to getting the message across, especially when it comes to stigma and discrimination. When you think about the key populations, as much as they want to come out and share their stories and make the world a better place, for want of a better word, there's still a lot of fear and anxiety because as far as they're concerned, there's so much homophobia, there's transgender hate, the persons living with HIV, the sex workers, they still feel as though they're within that bubble, that they have to sort of stay within their own reign and meet with their own kind as far as they're concerned. Do you think funding from corporate Caribbean will add to the message, getting the message out, making sure that we do what we're supposed to do, and again, reaching 2030 zero?
I think that you have made a very important point there. We have to get shared responsibility and partnerships going in a more consolidated way, and the corporate sector could play an important role, especially at a time when international funding is diminishing. And it's diminishing because of a conditionality that is imposed by the multilateral agencies on Caribbean nations designated as middle and upper income countries and therefore not qualified for concessional aid. And the more that happens is that we have been so dependent over the last 15 years on external funding for the AIDS program.
Yes.
In some countries as high as 90%. Trinidad is about the lowest on the level. It depends on external funding, only about 35% compared with 99% in Haiti, about 70% in Jamaica, and about an average of 60% in most of the other countries. And so I think corporate sponsors would want to we would want to target them for contributing, especially, as you say, to the program that the youths are initiating. But it's important to say, too, that we have, from the point of view of the UN and the UN Secretary General and his envoys, we have made good interventions along with the Pan-Caribbean Partnership to the donor agencies and the Global Fund, which has funded a lot of the programs on treatment and prevention over the last 15 years. They have agreed to broaden the transition period where they cut funding from the Caribbean to 2019. So that gives us about 3 years of getting funds, and especially for targeting key populations, prevention, and young women. So this is why I feel that if we can act in a concerted way
and act now,
yeah, we can. And this is why I think this launching of the National AIDS Coordinating Commission is a very important phenomena for Trinidad and Tobago, because what it does, it fosters the partnership. I'm pleased to see that the private sector, the people living with AIDS, that the government sector, and the UN agencies are all partners in this coordinated commission. And I believe that is the way that we have to do. And we find the areas that we must target, and we cooperate, shared responsibility in dealing with it.
Thank you so much. Thank you so much for that. I think that we need to have more people like yourself championing the cause of making sure that stigma and discrimination just dies a natural death. Although we know that's going to be very difficult, it's part of humanity and mankind. But in terms of HIV 2030, a lot of people would have heard about the 1990 targets, 1990 targets, not understanding fully exactly what it means. But what they do know is that, okay, we're looking at zero infections by 2030, and I think that we all need to work together to make sure that that happens. So, any closing comments?
Well, to me, I think that Trinidad is in a good position to lead this charge towards 1990, because Trinidad and Tobago has the highest rate, 62% of people on antiretrovirals. And this is a tremendous improvement from 5%, which existed in 2002. So to move it to 62% means that there must have been a commitment on the part of governments and stakeholders. But that is still not good enough to get us. So I think that we need to ensure that we accelerate that rate, and also that we do our best to leave no one behind.
Fast track, and I like that, leave no one behind, of course, that's most important. Thank you so much.
Thank you very much.
All the best.